Welcome everybody. In our today's translational longevity CellTalk series, Dr. Jogita Das will talk about central nervous system health status as an important predictor of longevity. Dr. Jogita Das is a clinical content writer at Renix, focusing primarily on oncology and immunology. She creates captivating white papers and engaging blogs that explore the latest advancements in cancer treatments and immunotherapies. Additionally, Yogita actively contributes to the content creation of the Clinical Gene Labs project. Yogita holds a doctoral degree in life sciences from Symbiosis International Pune, where her research concentrated on diabetes, cardiovascular complications, and vitamin D deficiency. At Linux, she has attained experience in scientific writing, further enhancing her skills and passion for elucidating intricate scientific topics. So, without further delay, let's welcome Jogita.
Thank you, Nupur, for such a nice introduction. Good afternoon, all. And today we'll be talk about central nervous system health status as an important predictor of longevity. Here are the list of references that we are discussing today. Why central nervous system, that is CNS health, holds the key to longevity. As we all know, that central nervous system regulates many vital functions of the body. It regulates involuntary functions like digestion, respiration, your blood pressure, heart rate, and many other functions. It is regulated by the central nervous system. So, assessing the central nervous system while predicting the lifespan or the life expectancy of individual is a key, or we can say CNS health holds the key to predict the life expectancy of human individuals. And there are many markers, or we can say indicators of CNS health that we need to measure, like the cognitive function. CNS health is mainly involved in the regulation of the cognitive functions, and as we know that as the person ages, there is decline in the cognitive function or the cognitive ability, like the memory, attention, problem solving skills, and executive functions. Also, with respect to the aging, persons have the decline in the motor skills as well. So these all functions should get preserved while assessing the while talking about the longevity. So decline in all the functions also how its correlation with the development of many neuronal pathologies, like the neurodegenerative diseases, Parkinson's disease, Alzheimer's disease, and this all leads to the increased mortality risk. Also, there are other factors that are associated, or that have an impact on the CNS health, that is the neuroplasticity or the brain structure. Actually, neuroplasticity, it is the ability of the brain to adapt and recognize in response to the experiences and other environmental changes. So if there is better neuroplasticity, it can exhibit the better cognitive outcomes. Also, neuroinflammation have impact on the CNS health. If there is chronic neuroinflammation, which have its implication in the many pathologies associated with the neuronal network, or the we can say the neurodegenerative diseases or the neuropsychiatric disorders. So, maintenance of the low level of the neuroinflammation is associated with the better outcomes of the CNS health. Also, neuronal connectivity, brain organizations of the brain networks. The assessment of these all parameters has its impact on the CNS health. And if we try to assess this, or we measure these parameters, then we can come up with some factors that can have its influence on the longevity. As because we know that as the person ages, despite of being any type of the neurodegenerative diseases, we can say the normal healthy aging. In normal healthy aging as well, there are some changes, structural and functional changes in the brain neuronal networks, like the gray matter volume loss, white matter lesions, and the cortical thickening. So these all factors, it is the indicative of the common features of the aging and the neuronal pathologies. So preserving brain structure, particularly in regions which is important for the cognitive functions or the deciding cognitive ability of the person, is indicative of the better CNS health. And while assessing or the predicting longevity, we can utilize this type of the assessment, or we can say factors. Also, neurotransmitter, which plays a major role in regulating the mood, cognition, and the behavior of the individuals. So, this delicate balance of these neurotransmitters like dopamine, serotonin, and the acetylcholine is important, and we should measure this neurotransmitter balance, because if there is regulation in these neurotransmitters, this regulation is associated with development of many different types of the neuropsychiatric disorders. So there are determinants of CNS health, some factors that can have direct or indirect impact on the CNS health. So stress resilience, actually it is the stress management, we can say. It is the ability to effectively cope up with various different types of the stressors, like physical stressors, mental stressors, and the environmental stressors. And maintain psychological resilience. It is closely linked to the CNS health. And if there is chronic stress or the dysregulation of the HPA axis, that is hypothalamic pituitary adrenal axis, so this has its implication in the development of neuroinflammation, neuronal damage, or neurological shock, cognitive decline. So underscoring this all the factors, it is the importance of this stress management in promoting the longevity. Also, one major factors that can have its impact on the CNS and ultimately on the longevity is the sleep. Having adequate sleep quality, a sound adequate sleep is crucial for the CNS health, like to maintain the memory, attention, cognitive abilities like the memory and the attention. Other factors that we should consider while talking about the CNS health, it is the vascular health. As CNS health is heavily depend on the vascular system to deliver oxygen, nutrients, and the essential molecules. So various vascular risk factors have their impact on the CNS health, and these factors include the blood pressure, that is hypertension, diabetes, atherosclerosis. So if there is presence of these vascular risk factors, it can compromise CNS health, and which can make individual more susceptible to have the stroke, cognitive decline, and the many neurodegenerative diseases. Also, some lifestyle factors have positive and as well as negative impact on the CNS health, like your dietary habits, whether you are physically active or inactive, which type of the social engagements you are doing, and the cognitive stimulation. These all factors have profound impact on CNS health and the longevity. So, adapting a brain healthy lifestyle, which is mainly characterized by the balanced diet, regular physical exercise, good type of the social engagements, interactions, and the cognitive engagements can promote a neuroprotection, neuroplasticity, and the cognitive resilience. So here we are discussing about some major findings. Here there is one study, that is Lothian Burt cohort 1936, which is also called as LBC 1936. This study have tried to decode the cognitive aging. They have come up with various different predictors of the cognitive aging, and their main focus is to understand the cognitive ability in different individuals, because every individual has different cognitive abilities, and also they have different rate of the cognitive decline with respect to the aging. So in this study they have performed a follow-up 12-year follow-up study on the 1091 individuals, and in these individuals they have conducted over 5 assessments at different ages of them, ages of these individuals. First assessment they have performed at the age of 70, then 73, 76 at the age of 79, and then last assessment they have performed after 12 years, that is at the age of 82 years. And they have measured various cognitive abilities like the visuospatial ability, processing speed, memory, verbal ability, and the general cognitive factors. Along with this, they also address multiple risk factors across the life course of these individuals. And they found that among all these individuals, apolipoprotein E4 carrier status is found to be reliably informative or the indicative of the general and the domain specific cognitive decline. So by using this ApoE4 carrier indicator, we can able to identify the individuals those are at higher risk of the accelerated cognitive aging. Also, they have assessed other life scores factors, but they found that other life scores factors like education, health, socioeconomic status of the individual had minimum impact on the cognitive decline, or they had minimum impact on the indication of the cognitive decline. Other aspect to predict the longevity, or we can say cognitive health, it is the prediction of the cognitive impairment. The individuals, those who are suffering from the cerebral small vessel disease, they have high rate of the cognitive impairment. But to predict cognitive impairment in these individuals, it is difficult. So we need some type of the prediction models to indicate cognitive decline in the individuals, in elderly individuals with CSVD. So in this study, they have studied 210 CSVD patients with different types of the cognitive levels, that is normal cognitive levels, mild cognitive impairment, and the dementia. And here they have performed brain imaging, the MRI. They have collected major data by performing the MRI, and then they measure vascular different then they perform different vascular measurements, and they analyze all that data, and they found that the brain atrophy and the vascular lesions, these all factors, that is loss of neurons, neuronal connections, these factors get worsened with the cognitive decline. If there is accelerated cognitive decline, there is high rate of the loss of neurons and the neuronal connections. So this can have accelerated cognitive aging in these individuals. In addition to this, they have assessed linear brain measurement parameters. They have performed various parameters in this linear brain assessment, and they found that these parameters are the good predictive. These parameters have a good predictive power to identify the mild cognitive impairment and the dementia in these individuals. So, is there any importance of this linear brain measurement in human longevity research? So, by measuring linear brain measurement parameters, we can able to identify different neurological markers, and these neurological markers can be used to assess the cognitive ability and the rate of cognitive decline in that individuals. Also, certain parameters that will get from the linear brain measurements may serve as a predictive biomarkers for longevity. Also, the pattern of brain atrophy or enlargement in specific brain region, they may be the indicative of individual's susceptibility to age-related cognitive decline. Also, the impact of any lifestyle changes, we can able to get valuable insights on the impact of lifestyle interventions on on the cognitive stimulation on brain structures and the longevity. The next approach to come up with the CNS health or the cognitive aging is the brain network reorganization. As the person healthy aging involves, actually in healthy aging also there is some structural and functional changes happens in the brain, even without the any type of the neurological pathologies associated with that. If healthy person is aging, then there is some structural functional brain changes happens. There is some changes in the brain neuronal connections. There is some changes in the loss of volume of the gray matter. So these all changes need to be assessed in healthy individual as well. So this study have assessed all these structural and functional changes in healthy individuals. For that reason, they perform the MRI scanning. They have collected all the data on the basis of the resting state functional MRI, and they found that there were widespread reorganization of the brain network with respect to the aging in healthy individuals as well. So there are some changes in the functional connectivity as well. So these changes can mediate the relationship between aging and the cognitive decline. So investigation of the reorganization of the brain network with respect to the healthy aging can help to predict the cognitive decline. It can help to promote the healthy aging and the guiding intervention with respect to the changes in their brain changes, what type of the structural and functional changes are there in their brain regions. Another approach is to study the cognitive reserve. Sustainable cognitive health is mainly is heavily relies on the cognitive reserve. So actually cognitive reserves is the ability of the brain to maintain normal cognitive function despite age related changes, any neurological insert or any type of the neurological damage. And actually cognitive reserve is mainly determined by your cognitive abilities that you develop during your childhood or early adulthood, that gives the cognitive outcome in the latter stage of your life. So in this study, they have analyzed this cognitive reserve in these individuals, the 5,000 individuals. Those were cognitively normal individuals and age between 48 to 80 years. And they studied whether CR moderates the relationship between white matter integrity and the cognitive function in these individuals. And they found that early fluid intelligence, it plays a significant independent and moderating role in cognitive performance. So these findings suggest that the early fluid intelligence, it is suitable as a CR proxy. It can early, by studying the early fluid intelligence, it can give you the picture about the cognitive result. So by measuring the cognitive result, it shows a promise in promoting a sustainable cognitive health. It can give you valuable insights on the protecting against the cognitive decline and reducing many disease burdens. So another approach is the neuroimaging based biomarkers. We can measure neuroimaging based biomarkers to predict the cognitive aging in these individuals, and to study to come up with the brain aging, what type of the brain aging is there. So in this study, they have performed the extensive neuroimaging by using the MRI technique and the PET imaging, and they have calculated the brain age in that individuals in these individuals, and they come up with one value, that is brain predicted age difference. They have subtracted brain age from the chronological age, and they have come up with this brain predicted age difference. And in this study, they have observed that the female participants, they had less brain aging as compared less rate of the brain aging as compared to their chronological age. And they found that female participants had 5.4-year younger brain predicted age difference as compared to the male participants. Also, they found that if there is higher rate of the brain PAD, that is brain predicted age difference, then this associated with, or this can imply the increased cardiovascular risk, cerebrovascular disease risk, and the lower cognitive performance. It is also linked to the future atrophy, which is related to the hippocampal region of the brain. So brain PAD, it is a suggestive of the summary metrics of the brain health. It can provide valuable insights on the pathological brain aging, and it can offer potential prognostic value. Coming to the conclusion of today's talk, CNS, it is a major system which plays a crucial role in regulating various body functions and maintaining overall mental and physical health. So healthy CNS is associated with better cognitive function, better cognitive abilities, having improved motor skills, and the enhanced autonomic regulations. So neurological disorders and age-related cognitive decline are also associated with linked to the shortened life expectancy. So this highlights the significance of the assessment of the CNS health, or the prediction of the CNS health, or the healthy cognitive aging in determining the longevity. So there are some approach that should highlight or that we can adopt to have healthy CNS aging, or we can say healthy cognitive aging. These factors are the some little modifications in your lifestyle, having a healthy lifestyle, brain healthy lifestyle, adopting preventive healthcare practices, and implementing targeted interventions. And so these all approaches can help to enhance your CNS health and potentially prolong your life expectancy. So thank you for your patient listening. You can find me at yogita@trainings.org. Thank you.
Thanks, Jogita, for this nice talk. So if anybody has any question, he or she can send it to the chat box. I don't see any questions, so let's close the session by thank you, Jogita, again. Thanks to everybody for your patience and joining with us.